Soumya, National Chief Program Coordinator, Organization for Food Safety Solutions and Awareness, in short, OFSSA. I'm so glad to say this is our second national webinar on the head note food safety for children. And today's webinar on the topic hazards of junk food, measures to control, jointly organized by coordinators from state of Karnataka, Tamil Nadu and Kerala. With great happiness, I welcome all of you into this webinar. I welcome all state and national leaders of OFSSA. Chief guest of our webinar, Professor K.V. Thomas, former Union Minister, Food and Civil Supplies and Public Distribution, and resource person, Dr. Jeeson Unni, Senior Consultant, Pediatric, Aster Medcity, Kochi. And most importantly, each and everyone joined in this webinar. I welcome all of you into this webinar once again. The purpose of prayer is not to influence God, but to influence our own mind. Let's begin our webinar with a short prayer. I welcome Grandmaster Tirtha Vivek for the prayer.
Binders together, binders together, binders together with love. There is only one rule. There is only one body. Binders together, God. Binders together, binders together with love. We are the children of God. We are His promise divine. Bind us together, God. Bind us together. Bind us together with love. We are the children of God. We are the children of God. Bind us together with love. God, bind us together with love.
Thank you, Tirtha. We are beginning our session with a lot of gratitude. Great gratitude to Dr. Abraham Verghese, former IMA State President, and Dr. R. Manju for providing us with good session in the first webinar series. And now we have our chief guest of the webinar, Professor K.V. Thomas, Professor, former Union Minister of Food and Public Distribution, and more than that, retired college professor with more than 33 years of teaching experience, and writer, social worker, and he is currently representing a special representative from state of Kerala. With great honor, I welcome Professor K.V. Thomas for the message on food safety. Over to you, sir.
Thank you very much. I'm indeed happy to be present in this webinar when we are discussing a very important topic like food safety. I had the opportunity to go through this subject when I was the food minister of the country. One of the major issues we are facing in the country is the quality of the food. Very often, the food itself is of inferior quality. I had an occasion to participate in a seminar where we discussed on food waste. So what to be done? Because there are hundreds of people who are hungry, who need quality food. At the same time, a huge quantity of food itself is being wasted. Second is how the people know that the food is of good quality. So we have started food safety clubs throughout the country, in the schools and colleges, where through simple experiments, the students themselves can decide the quality of the food items. You know, many of the food items supplied, whether in the form of fish, meat, or curry powder, are of inferior quality. So we have to find a way out. At the easiest and the cheapest way to decide the quality of the food item. So we taught the students, the teachers of various colleges in the school how to test the curry powder, how to know the fish you are getting is fresh, how the meat is good, the vegetables are good. So these are some of the simple mechanisms we brought before the students. And I think today's webinar, there are a large number of experts who have been in this field who will be able to guide the youngsters on good quality of the food. So food should be available to the people. Food should be of good quality. So I think it's an important subject where our youngsters' mind can be trained. I congratulate the organizers for this seminar and to give an opportunity to participate in this.
Thank you so much, sir, for your inspiring words. It has been a great honor. Your presence itself is a great honor for us. Thank you, sir.
Seminar, there was one more function to attend, which I told when I was invited. I'm sorry that I have to drop out of the seminar in the beginning time itself, but sometime I think I will be able to attend the seminar continuously for the full time. Thank you.
Thank you so much, sir. We understand your busy schedule. Irrespective of your busy schedule, you gave us this time. Thank you so much for your precious time for us. Thank you once again. Now we are moving to our webinar session on hazards of junk foods. Junk foods are always a crazy matter for kids and at the same time concern for parents also. In this context, we have a right resource person to help us to understand what are the hazards of junk food and how can we take the measures to control all that. I am very proud to introduce Dr. Jeeson Unni, Senior Consultant, Pediatric, Aster Medcity, Kochi. We are blessed to receive you, Doctor, for this session. He has more than 30 years of experience in pediatric, more than as Chief Editor of Indian Academy of Pediatric Drug Formulary, Editor and Reviewer of various pediatric journals, Vice President, Indian Academy of Pediatrics South Zone, and more than his recipient of several state and national rewards instituted by Indian Academy of Pediatrics. It's a big honor for us to invite Dr. Jeeson Unni into this session. We welcome you, Doctor. Over to Dr. Jeeson Unni.
Thank you, Dr. Soumya, and all of you. It's a great pleasure to be with you all. Now, how do I share my slides? I'm not really certain.
No, Doctor. Can you try once again?
How do I share? What is the sharing?
In the below button, there is a upward arrow. Can you see that? And
Upward arrow.
just near to that hand button, hand raising button is there.
Yeah.
Yes, now it is working.
Okay.
Now your screen is visible. Now you have to open the slide. You can go to the slide. Yes, doctor. Now it is visible. Yes, it is visible.
Okay. So thank you so much. It's lovely to be with all of you. I'm thankful to the organizers for having taken this topic up, because it's something that is very relevant for pediatrics and for adults in medicine. Because we, as IAP, Indian Academy of Pediatrics, we've been doing this program for a long time. And the school mission of that, which was our Presidential Action Plan 2021, Dr. Piyush Gupta, was basically on junk foods. And we did 1 year of a lot of programs, and it's continuing this year too. The program is workshops on all over India to galvanize the pediatricians and their patients to understand what junk foods are all about and what are the things that we could do to prevent junk food use in our society, and what's the problems with this use. Now we know the global burden of diseases, non-communicable diseases, is about 61%. Non-communicable diseases are diabetes, hypertension, cholesterol, heart attacks and all that are all non-communicable diseases. And the World Health Organization says that 41 million deaths each year are due to non-communicable diseases. 71% of all deaths are due to that. So the non-communicable disease kills about 2 in 3 people on the planet. It's a huge number of kids that are dying because of non-communicable. It's a disaster. So the top 10 causes of death: ischemic heart disease, stroke, lower respiratory tract infections, chronic pulmonary disease, cancers, diabetes mellitus. These are all part of the non-communicable disease that you're going to think about. So these are all diseases that we could prevent by doing proper nutrition. The major killers are heart disease, cancer, diabetes, and chronic respiratory diseases are now global and not restricted to affluent class. It's all classes of society are affected by these 4 dreaded diseases, major killers. Common risk factors include tobacco use, alcohol abuse, unhealthy diets. That's what we're talking about today, and physical inactivity. So 77% of all the non-communicable disease deaths are in the low and middle income group countries. So that's where India is. That's why we're going to stress on this factor. And we know that 4 non-communicable diseases cause 80% of all non-communicable disease deaths. They are diabetes, respiratory illnesses, cardiovascular diseases. So these are all diseases which we could prevent by unhealthy eating, tobacco use, physical activity, and excess alcohol. So the prevention is two-phase, 2 major barriers. Doctors are mainly trained to diagnose and treat and cure the non-communicable disease, but not to prevent them. And 4 risk factors are governed by the powerful economic operators. So unhealthy diet, the main risk factor, hence rightly called the slow motion disaster, as it can take years to become catastrophic. Over years, the body starts reacting to this bad, unhealthy diet, and the addition of these are the 5 or 4 or 5 diseases that we're worried about: heart disease and stroke, diabetes, cancer, chronic lung disease, and other NCDs. Now, therefore, the Indian Academic Pediatrics came out with a outline background of the problem, IP guidelines, objectives, and processes. Terminologies, the new use terminology, we call it junks, JUNCS. Burden of junks, factors increasing consumption of junks and harmful effects of junks. Existing recommendations, guidelines, and policies, and IAP junks, guidelines, and recommendations. So these are the way that we're going to go through the slides today. So you have a triple burden of malnutrition, wasting, and stunting, and underweight. That's one. Obesity and overweight is the next. And the hidden hunger, the micronutrient deficiencies. The triple burden of malnutrition that we have. The global epidemic of child and adolescent obesity in India is the 3rd highest country for adolescent obesity. 10-fold increase in childhood and adolescent obesity in 4 decades time, and the NFHS 2015-2016 in India incidence of obesity has been doubled in the last 5 years. So therefore, the United Nations Decade of Action on Nutrition is what we're going to talk about. We have poverty, we have zero hunger, good health and well-being, quality education, gender equality, and all these things will all percolate to have sustained development goals for the year. The nutrition plays a big role in all of this. At the heart of every sustainable development goals, it gives $1 of nutrition and gives you $16 return. That is what we're going to do. Nutrition, $1 of nutrition investment is going to give you $16 of return. So that's 16-fold increase the returns by adequate nutrition. So nutrition is a vital precondition for achieving these goals, and achieving these goals supports nutrition, vice versa. So what do we talk about? Unhealthy diets. Unhealthy diet means food production is industrialized, aiming on increasing the production, increasing the convenience in cooking, and producing hyper tasty foods. That's what the food industry is doing. They're producing unhealthy foods because increase the convenience. Cooking is less, and you have these unhealthy foods, and there is a very, very tasty food is produced. Thus, food production is now divorced from its primary purpose of providing nutrition to make healthy human life. It's mainly commercial now. That's the problem that with nutrition now, with all the industry. So unhealthy diet is increasing. The last 2 decades, there has been an increasing trend of consumption of fast foods, sugars-based beverages, caffeine drinks, energy drinks in Indian children. That's what we're going to talk about. 2 decades of increase the trend of consumption of these very, very unhealthy foods. The Center for Science and Environment, CSC, on 30,200 children, they study on 9 to 14 years of age. About 93% of children eat unpackaged food and 68% consume sugar-sweetened beverages once a week, more than once a week. That's the issue in India. See, in India, you have so many children. If they want to have over time, the diet has changed from the Indian diet has changed to the packaged food and sugar-sweetened beverages. Fast food industry is therefore expanding 40% every year, and there's easy availability, convenience, and palatability. Working parents have a problem. If they can't produce food, they can't cook food at home. Attractive presentation is there, catchy advertisements, and vigorous marketing strategies are the major factors for high consumption of these products. As we all know, these are all things that we can't tackle unless everyone is active in this field. So, the felt needed guidelines related to consumption of food drinks for children, and this is what the guidelines came in our recommendation. The Indian Academy of Pediatrics Journal of the Indian Academy of Pediatrics, we had this recommendations. And this is the Pediatric and Adults in Nutrition Society. It's a chapter of the Indian Academy of Pediatrics. Commented recommendations on consumption of fast foods, fruit juices, and energy drinks in children and adults in India. This was published in August 2019. The victims of this study was that primary prevention of chronic non-communicable disease and obesity. That's what the first intention was. For children and adults in 6 months to 18 years of age, all the guidelines are there for that. Are meant for children with normal growth and nutrition status and not applicable for undernutrition and other chronic systemic disease. So basically, we're trying to have all the majority of children who are normal to become normal in society. Regular physical activity is essential along with healthy diet. So that's important. Physical activity is something that has to go along with a normal healthy diet. Now, this is a big consultation. We had a lot of consultation with IEP, with WHO, the UNICEF, Ministry of Health for Welfare for Women. We had ICMR and that is the National Institute of Nutrition, and from Hyderabad, and experts from Medical College College. They considered groups. 4 subcommittees were constituted. Definition, magnitude, harmful effects, strategy to prevent consumption, recommendation and guidelines. So 4 committees were constituted, and literature review was done. We had a national consultant group meeting in March 2019. The final draft was approved and published in August 2019. So that's the whole process that went through to make the guidelines. Nomenclature: one name for all unhealthy foods and drinks. What is the nomenclature? Foods which are undesirable nutrient content, undesirable quality, potential to consume in large quantities, hyperpalatable, or containing toxic substances. These are 4 indicators for saying that food is unhealthy. Undesirable nutrient content, quality is bad, 4 P's that we'll talk about, potential to be consumed in large quantities, hyperpalatable, very, very tasty, and containing toxic substances. So these are some of the nomenclatures that we run beside foods that we have. Fast food. One is fast food, junk food, that is the high, and the fruit juices, fruit drinks, and nectar, energy drinks, ultra processed foods, machine processed foods, and a few more. The energy dense, low nutrient density foods, the energy dense, nutrient food, poor foods for children, and the food from of minimal nutritional value. So these are the nomenclatures that we have for undesired foods and drinks. The new term was coined by IAP on consensus. We call it junks, and it's simple to understand, acceptable to lay population, pediatricians, and catchy to remember. So the junks, a new acronym by IAP, was accepted as perfect the world over. We had under this junk foods, that is the high in fat and salt sugar, HFSS, that is high in fat, salt and sugar, bad for health. Under ultra processed food, that is NOAA, classification group 4. The nutritionally inappropriate food, caffeine, carbonated colored drinks, CCS. and the sugar-sweetened beverages (SSBS). These are four called type of foods are included in the junks category. And we had publicity in the Times of India and the Indian Academy of Pediatrics journals. So the factors for increasing use of junk foods by the adolescents is that it's favorable demographics. So it's mainly in the urban areas more. Now it's particularly the rural areas too. Increasing urbanization. So jobs and studies, you have many people in the urban areas where they don't have enough time for anything other than their job. Increase in women workforce, so there's no woman in the house to cook. Growing middle class, nuclear families, so there's no joint family with grandmother not there to cook. Online delivery and digitalization should be totally banned because online delivery is something that has caused a lot of problems for as fast food, increase in use of food, fast food digitalization, hyper the higher experimentation changing consumer preferences by the adolescents. So these are all factors that we've recognized as also increasing use of consumption of junk foods. Why do the adolescents use unhealthy foods? Because it's tasty and convenient, it saves time, quick, it's very quick. Anything that's quick fix is easy for the adolescents. Adolescents want everything quick and fast. Better ambience, in a better company, peer groups, they are joining up in KFC and other places where it's the ambience is good and they could get together and talk. This pre and post operative work. Without any work, you can get the food. It's a fast food. You can just go there, take the food, and leave it there. You don't have to clean up. That's a problem. Pre operative, post operative work is not required. They try out a lot of new things, new stuff. The junk food industry brings out a lot of new stuff, and there's new things to try all the time. This sad symbol, it's a pride and showing off that they've gone to this place. And media and peer influences are also there. These are all factors why adolescents take on an unhealthy diet. Somebody reviewed made results in review articles and came out from all over the globe, and based on available evidence, the group has evolved the concise statements summarize the effects of junk foods. And the adverse effects of junk foods are basically higher regular consumption. More than 2 times a week they're taking adults and taking junk foods. And that causes a higher BMI, the basal metabolic, the body mass index, the body mass index of children, and overweight and obesity. The body mass index is calculated by weight by height squared, and with this you can find out the amount of body fat in the baby, fat in the baby child's body, and you find that the BMI is much higher. About 85 to 95 is called overweight, and above 95 is called obesity. About 95 means 95, and children will have less fat than more. If you have 100 children, 95 will have less fat, or 5 will have more fat than a particular child at 95. So that's how you calculate BMI. And the BMI is increased much higher in these children. Insulin resistance is developing. Insulin resistance, when you have these obese children having black pigmentation behind the neck, it means insulin resistance is developing. You develop diabetes much earlier. Child hypertension is possible, and they're prone to adverse psychological behavior. So this is in the Western diet, of course, you have shown that lots of studies have shown that the high levels of LDL, adiponectin, triglycerides, and fasting glucose are high. The metabolic syndrome, that's called the metabolic syndrome, where you have high sugars, high fasting sugars, the higher levels of low density lipoprotein, adiponectin, and triglycerides. They're all hyperlipidemia and fasting blood sugars are high. They have fatty liver, they have PCOD, that is the ovaries are full of cysts. These children are going to have a metabolic syndrome, and they're going to have a lot of problems later in life. The fatty liver, they're still not going to have cirrhosis later. The higher LDL and high density lipoprotein, they're going to have heart disease. So diabetes, these are all problems that could occur in these children, and they're going to have a lot of difficulties during life. So the issue about the metabolic syndrome in adolescents is that they don't require medication. That is the best part of it. If they're able to understand the need to reduce their junk food intake, do a lot of physical activity, and reduce their BMI, the likelihood of their developing this lifestyle disease are much less. If they continue to be obese, then the chance of their having lifestyle is 20 times more than the population. The children have to realize that it's their life, and they have to understand what they can do to make their life much easier. So we're going to talk about carbonated drinks, caffeine carbonated energy drinks. So the higher consumption of more than 4 per week in most adolescents. There's a lot of studies which showed that in India there are a lot of children having carbonated drinks like Coca-Cola and all that. So apart from weight gain, it also causes cardiocytotoxic, cardiac arrhythmias, cardiac heart rates can go up very haywire with these children. They can have sleep disturbance, psychiatric disturbance, and increased screen time is always possible. So these are all problems which could occur when they have a lot of these caffeine carbonated drinks.